Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Specific conditions of chronic alcohol poisoning. 1. Rum fits or grand mal withdrawal, which is withdrawal of alcohol. On withdrawal of alcohol, the patient may develop rum fits or grand mal epilepsy. Second, morbid jealousy or alcoholic jealousy. Here the patient can have Wernicke's the patient can have delusion of reference, delusion of persecution, and delusion of infidelity. Munich beer heart. Munich beer heart is seen in alcohol is called as alcohol cardiomyopathy, where heart is affected. Wernicke's encephalopathy shows decreased intake or absorption of vitamin B1. Korsakoff psychosis shows confabulations and polyneuropathy. Mania a patu is seen. Delirium tremens is seen in alcohol withdrawal, that is typically 3 to 4 days after alcohol withdrawal. The patient presents with coarse tremors, irrational fear, mild hallucinations, delusion of horror, disorientation are seen. Acute attack of this is also called as acute attack of insanity. It is dealt under the section 84 IPC.
thank you and thank you for watching.